I'm at Greater Edmonton Eye Care this morning, and we are talking about a program designed to help kindergarten-age children with eye care to prevent learning troubles. And I'm with Dr. Kiani, and we are talking about this program. It's a great program, I See, I Learn. What is this program?
So this program is started by the Alberta Association of Optometrists in conjunction with Alberta Health. So what this program entails is families with children that are going into kindergarten starting in July are entitled to a free pair of glasses if they're eligible. And then Alberta Health will have some coverage towards an eye exam.
Okay, and how do we know maybe if our child of that age is in need of an eye exam?
They have to come in and see their optometrist. We will do a full, thorough eye exam, and then it'll be determined if they need glasses or not.
Are there sometimes some signs that a child might show that indicates that they really should get an eye exam?
Yeah, so some signs that parents should look out for if their child is squinting, even a slight head tilt, if their eyes turn in or out, or if they're just bringing stuff close, that also is, those are some early signs that your child might need glasses.
Okay, and how do we go about booking an appointment, and what are the best practices?
So if you don't have an optometrist, you can go on the Alberta Association website, put in your postal code, and you'll have optometrists that are close in the vicinity of where you live. And then so just call up the clinic and let them know that you want to participate, or you have a child in kindergarten and you would like to book an eye exam for the I See, I Learn program.
And how often should our children be getting eye exams?
So we recommend a screening at 6 months of age, and if everything is well, then at least a full, thorough eye exam by the age of 2 or 3.
Okay, perfect. And we're going to be talking more about I See, I Learn as we go throughout the rest of the morning. I'm at Greater Edmonton Eye Care this morning, and we are talking about a program, I See, I Learn, designed to help kindergarten-age children with their vision to support their learning and eye health well-being. I'm joined by Dr. Kiani. And Doctor, what happens in an examination?
So whenever we bring the child in, we will start assessing their vision first, with or without any glasses. And then we will check their color vision, we will check their depth perception, we will check if they have any eye turns. We will also check for their prescription, and how we do that, we'll put drops in.
Okay.
And the drops will take about 30 minutes to work, and once the drops work, we will shine light in the eye through a special scope that we use, and then we will neutralize that light, and that we will figure out if the child needs a prescription. Also, because their pupils are nicely dilated, we will also look in the back of the eye to check for any eye disease, just to make sure the back is healthy as well.
And why is it important to check for eye health like that?
So not all vision problems is glasses related. It could be also back of the eye, it could be congenital cataract. We just have to make sure everything is okay.
Okay, so checking for a lot of things. What are some other tools that you use during the eye examination?
Yeah, we will check. When checking their color vision, we'll have a color book that we'll use. We'll have a book that shows if they have any issues with their depth perception. We have a certain instruments we put on our head. We look in the back of the eye, and obviously the instrument that we put in front of the eye to check for glasses as well.
Okay, and when it comes to checking for kids' eye health, if they do need a prescription, what happens next?
And so let's say at the end of the exam, we will educate to the parents if whether the child needs glasses or not. And once they need the glasses, they will go into the optical, and then they'll meet the optician, who will take some measurements.
Perfect. So a very seamless procedure, and very kid-friendly as well. We're going to learn more about this program and how you can become part of it if you have a kindergarten-age children. I'm at Greater Edmonton Eye Care this morning, and we've been talking about getting your kids' eyes checked and proper eye health, and when that should start. I'm joined by Dr. Kiani. When should we start getting our kids' eyes checked, and how often should we do it?
So we recommend a routine screening at 6 months of age. If everything goes well, then the next full routine we do recommend by the age of 2 or 3. And then afterwards, at least an annual eye exam.
And do kids' visions keep changing as they age?
Yes, they do. They do keep changing. So as a child grows, gets taller, the eye becomes longer. The eye can actually become nearsighted, meaning distance blur.
Okay.
And it all depends too. If eye disease wasn't caught early, they can also get lazy eye later on in their childhood.
And that can then affect their learning. How does affect the classroom as far as if they are maybe nearsighted and they can't see things? how does it affect their learning?
So a child sitting in the back of the classroom won't be able to see the board. And a lot of the times children will think it's normal. They won't tell their teacher, especially if they're younger. And so if they're not gonna see, they're not gonna do well academically. Some sports they won't be able to play. Even playing with other children, they might be too shy because it's blurry, and the child really won't tell the parent or tell the teacher at such a young age that, hey, my vision's blurry.
Right, and they may not even realize something's wrong.
Exactly.
And when kids are going to school, a lot of times it's right into kindergarten, and that's the perfect age to start getting your kids' eyes tested, and there's a program designed for these age children.
Yes, this program is called I See, I Learn, and it's a wonderful program. It doesn't depend on your income. It's covered for everybody, and so you can find your optometrist online, whoever participates for it, at the Alberta Association website. And so it's wonderful because with some parents who can't afford glasses for their children that really need it, can kind of jumpstart that.
Perfect, and we're going to talk more about that program coming up. I've been spending the morning at Greater Edmonton Eye Care, and we've been talking about a great program called I See, I Learn. It's designated to help kindergarten-age children with their eyesight as they enter into the school system. I'm joined by Dr. Kiani. Doctor, tell us about this program, I See, I Learn.
So I See, I Learn program is offered by the Alberta Association of Optometrists, and it's available to all Albertans having children going into kindergarten. And so with this program, in partnership with Alberta Health, having coverage towards the eye exam, we'll offer a free pair of glasses if the child is eligible.
Okay, and for a child, maybe this is the first time that they're going to an optometrist. Tell us about that experience. Is it intimidating or is it pretty easy?
At first it will be intimidating for the child, but we do have some certain pediatric instruments that we use to get their attention. We have a little bit of treats here and there we would give to the patient. So at the end of the exam, the child is fine, and it will definitely come back because we make it fun for them.
Perfect. And how do we know if our child is eligible, and how do we find an optometrist?
So all Albertans that are going into that have children going into kindergarten are eligible despite whatever their income is. And so how they can find out is on the Alberta Association website. They can put in their postal code and pops up a list of optometrists. Beside that, the name of the optometrist, there will be an icon, and that will state that if they are participating in the program or not.
Perfect. And what cost is covered by Alberta Health?
So Alberta Health will cover some towards the eye exam, but I do encourage parents to call beforehand to see if there's any additional fees that other clinics will charge.
Perfect. And again, where do people go if they want to sign up for the program?
The Alberta Association of Optometrists, their website.
Thank you so much. And if you would like to learn more, you can always go to the website at the bottom of our screen.